So this video will be for goniometry of hip flexion and hip extension. So we will do hip flexion first. You'll have your patient in supine. You're gonna bend your knee up. Our fulcrum is going to be at the greater trochanter. So I'm gonna put that there. Our stationary arm is gonna be with the lateral aspect of the pelvis, and the moving arm is gonna go with the lateral aspect of the femur using the lateral epicondyle. Our normal range of motion is 120 degrees. So we're gonna come here, you're gonna push him into flexion. Beautiful. Come back down. We are at 131 degrees for flexion. So you can turn over on your belly and we're gonna do hip extension. Looks like a belly flop. So you're gonna use the same landmarks for here, and we are expecting a 20-degree range of motion. So we will palpate for the greater trochanter. We're gonna line up. And then what I'm gonna have you do is we're gonna come here. No, let me do it. And I'm gonna lift that leg up. Good. Come back down. And he is at 19. So this video is going to be for hip AB and hip adduction using the goniometer. You are going to line your fulcrum up of the leg you are moving to the ASIS, and then draw an imaginary line over to the opposite ASIS for the stationary arm. You are going to have your patient hold the stationary arm if they're able, and then your moving arm is going to line up with the anterior midline of the femur using the midpoint of the patella as a guideline. You are going to take the patient's leg, making sure their pelvis doesn't move, and pull out into a abduction. Beautiful. We're going to take this, put it down, it's meant for 90. We are at 48 degrees, and then to do hip adduction, wow, you're so good. You would move their opposite leg away using the same landmarks. Do that, and then you're going to hold it again, and then you will move the patient's leg inwards. Good. And relax. Beautiful. And he is at 29 degrees of hip adduction. So for this video, we are going to do hip internal and external rotation with the Goni. This is a super weird angle because of how our bedroom is, but he has the towel roll under his leg, and I am going to come on this side first. Our fulcrum is going to be at the patella. Our stationary arm is going to be perpendicular to the floor, and our moving arm is going to be along the anterior crest of the tibia. So we are going to line up here. Perfect. And I'm just going to have you hold if you don't mind. And then we're going to hold that nice and straight, and we are going to move that leg into external rotation. You are at 45 degrees there. Beautiful. And we're going to do the same thing for hip internal rotation from here. And we're going to come here. Same landmarks, so line up. I'm gonna have you hold again if you don't mind. And then we are gonna move that leg out into hip internal rotation. We are going to be at 44 degrees of internal rotation. So this will be the MMT for sartorius. We are going to do this leg. You're going to have your patient in short sitting. You're going to sit up nice and tall for me. And then with this leg, what you're going to try to do is bring this heel up towards this knee like a hacky sack motion. Perfect. That would be a grade 3. A grade 4, you're going to have your patient do the same thing. And then you are going to apply resistance, trying to break him out of that. Grade 4 would be moderate resistance. Grade 5 would be maximal resistance. For a grade 2 test, you're going to have your patient laying in supine. Beautiful. And then what you're going to have them do is you're going to have them take the leg that you're testing and place that heel on their calf. And then you're going to try to slide that heel up your leg. Beautiful. That would be a grade 2. A grade 1, you can come back straight for me, would be a palpation at the sartorius. So this will be the MMT for hip flexion. You're gonna have your patient in short sitting with his legs over the side of the table. For a grade 3, you're gonna have your patient lift their knee up towards their chest. Beautiful. Grade 3, come on back down. Grade 4, you're gonna lift up again for me. I'm gonna apply pressure at the knee, pushing down. Grade 4 would be moderate resistance. Grade 5 would be max resistance. For grade 2, you're gonna have your patient inside lying with the test leg on top. So you're gonna lay on that side for me. And then what you are gonna do in this position is you're gonna have the patient bend their bottom leg, top leg will stay straight, and then you can support under the knee, and you are gonna bring them into hip flexion there for grade 2. You're gonna lay on your back for me for grade 1. You can bend up your knees for me. We'll bend this knee. Beautiful. And then you're gonna support here and you're gonna palpate at the psoas for a contraction as he tries to lift his leg into hip flexion. If there was no palpation, that would be a grade 0. Okay, so this test is for hip extension. We're gonna do the combination test first. So you'll have your patient in prone on the table. You are going to stabilize the pelvis and you're gonna ask the patient to lift their legs straight up off the table without tipping. Good, come back down, just straight up. So lift up again for me, and I'm gonna apply resistance, pushing down for a grade 4. If he held against maximal resistance, that would have been a grade 5. So for a grade 2, we're gonna do this leg just so you can see on the video, but you'll roll towards the window, good. And then you are going to keep that hip straight, and we're gonna bring the leg straight. We're gonna bring the leg back into hip extension, beautiful. And then if we were to do a grade 1, you would have the patient roll onto their belly and you would palpate the gluteus maximus looking for a contraction as they attempt to lift their leg. If there's no contraction, it's grade 0. If there is a contraction, it's a grade 1. For the isolation test of glute max, it's basically the same thing, but you're gonna have the leg bent to 90. Beautiful, so grade 3, they're gonna try to lift the heel up towards the ceiling. Good, come back down. And then lift up again for me, and you would apply resistance at the base of the leg. Good. Grade 4, if you could hold against maximal resistance, that would be a grade 5. A grade 2, you're gonna roll the same direction you rolled last time. Doing the opposite leg. We're gonna bend the knee this time though, and we're gonna pull back into hip extension. Beautiful. And then a grade 1 test would be the same, just palpating the glute max in the prone position. This will be the MMT for hip adduction. So for your grade 3 test, you're gonna have your patient laying on their side, and then you're gonna scooch back towards me as close as you can. Perfect. So this is gonna be a test for their bottom leg, so you have to get the top leg out of the way. So you're gonna lift that top leg up and back, and then what you're gonna have your patient do is lift this leg, keeping it straight up towards the ceiling. Beautiful. That would be a grade 3. A grade 4, you are gonna do the same thing, applying pressure, pushing down. Grade 5 would be the same with a maximal pressure instead of a moderate pressure. For a grade 2, you can relax. You're gonna have your patient laying on their back. Beautiful. I know we tested that leg last time, but we are gonna test this leg for the grade 2 just for the space that we have. You are gonna get their heel up off the table, and you're gonna palpate the adductor mass, and you're gonna have the patient try to move the leg in. Grade 2, if there was just a contraction there, it would be a grade 1. If there was no contraction in the adductor mass, that would be a grade 0. So this will be the test for hip abduction. So you're gonna have your patient laying on their side. Thank you, sir. And then we're gonna get that hip nice and straight with your body. Thank you. And then you are gonna support at the hip, and you're gonna have the patient do a straight leg raise. Beautiful, come back down. That would be a grade 3. Lift up again. You're gonna apply pressure, moderate, grade 4, maximal grade 5. If they could not complete a grade 3, you would have the patient roll onto their back, and you would palpate the glute medius, and you are going to support the leg and have the patient kick their leg out to the side for grade 2. If they were able to complete that motion, grade 2. If there was just a contraction as they were attempting to complete that motion, that would be a grade 1. And if there was no contraction at all, that would be a grade 0. For the TFL test, you're going to have the patient start in sidelining. Beautiful. You are going to take the leg and flex it to 45 degrees, and then you're going to attempt to lift the leg straight up from there. Grade 3, coming back down. A grade 4, lift up for me, and then you would push down. Grade 5, moderate or maximal resistance. For your grade 2, you're going to have the patient come to sitting. Beautiful. And then you are going to support here. You're going to palpate the TFL and have the patient try to move their leg out to 30 degrees of abduction. Beautiful. If they could do that, it would be a grade 2. If there was a contraction at the TFL, that would be a grade 1. And if there was no contraction, that would be a grade 0. So this will be the test for MMT of hip external rotation. You're going to have your patient in short sitting. You are going to have the patient attempt to bring their foot in towards their other leg. That would be a grade 3. You can relax. Grade 4, you're going to do the same thing, bring in, and you're going to pull out. Grade 4, grade 5 for moderate or maximal resistance. Grade 2, you're going to have your patient laying on their back. Beautiful. You are going to, can you just scooch up a little bit? Thanks. You are going to turn their leg into internal rotation and ask your patient to turn out into external rotation. Beautiful. Keep the knee straight though. Yeah. Out into external rotation. That would be a grade 2. A grade 1 is if there's any motion in this one because it's hard to palpate the external rotators. And a grade 0 would be given if there's no motion at all. So this video will be for hip internal rotation. We are going to do this leg. So you are going to have your patient kick the leg out towards the side. Beautiful. That would be a grade 3. From there, you're going to have them come again. You're going to push down. Good. Grade 4, moderate resistance. If you could hold to max resistance, that would be a grade 5. For a grade 2, you're going to have your patient laying supine. So lay on your back for me. Thank you. You are going to place their leg in external rotation, and you're going to ask the patient to roll inward. That would be a grade 2. If they could not do that, you would palpate the internal rotators, and you would have them attempt to roll